anything other than humans. They have never changed their routine other than us. Where we are talking about physical activity, we are talking about diet, we were talking about sleep, we were talking about stress management. What are the complications that a person, this is not for us to scare anyone, but what are complications of diabetes that you must look into?
Yeah, so basically there are, when you talk about diabetes, there are microvascular complication, macrovascular complication. So microvascular, we can talk about the nephropathy, the retinopathy, the neuropathy, all these things. So these are the things. And when you talk about the macro changes, cardiovascular symptoms, stroke, and all these things, peripheral vascular disease, all these things, go hand. So these are things that the common man should be, at least they should have a basic knowledge of these things. So only if they know the end result will they be more, careful right from the initial stage.
That means Dr. George was mentioning that heart attack is the complication. Yeah. So we should think from that angle also. Now, what do you think about this macrovascular? Like he was mentioning about coronary disease and stroke. How are they in diabetes?
They are interconnected actually. Like I already previously mentioned regarding the metabolic syndrome and all, if there is a diabetes patients are more prone for this heart disease, stroke, then like there are other major complications there, peripheral arterial disease. Everything is interconnected actually.
If you look at this world on a philosophical angle, look at the animals. Anything other than humans, they have never changed their routine other than us. So now the Creator created us with a biological clock which tells us when to sleep, when to wake up. The hormones act accordingly. As you said, the surge happens in the early morning hours. Now, interestingly, I don't know whether all of us ever even see that early sunrise, but that is important. We have to have this mind, early to bed, early to rise, keeps us healthy, better and wise. So that's rhythm, time, I think we must teach our children as well. Yeah. And one thing also, Doctor, you are mentioning about the stress factors in life.
Yeah.
What do you think how much is the stress factor?
No, because now in today's current world, we see that the amount of stress that each individual faces, maybe it might be related to work, maybe it might be related to their personal lives, it's on the rise. So all these things, we have, in our clinical practice, we notice that it is very difficult to control sugars in such patients. They might have some stress hiding, but they will not come out with it. So basically, one of the cornerstones in the management of diabetes, I would say, is establishing a good rapport with the patient and proper communication. So we need to extract from him what is actually troubling him.
Yeah,
that might help him.
That part is upon us doctors, because due to our busy schedule,
Yeah, and the number of patients that we see,
we are saying,
that might be compromised.
yeah, we do not find time to communicate with the patient.
Exactly.
Now, as Dr. George was mentioning, if you have more time for a patient, at least he can open up. Now, in the context of diabetes, it's important because as Dr. Nahul was mentioning, as sleep increases the cortisol hormones, stress is another important factor that can increase the cortisol. So what happens, even if it is not the sugar, why don't we look at the obesity factor? You are more stressed, more cortisol, more fat. And when there is more fat, there is more insulin resistance. More insulin resistance, more diabetes. So this vicious circle, one element is stress that is triggering. And as Dr. George is mentioning, it is a cornerstone. So when we in our practice, we are busy discussing about sugars, the numbers and the values, we do not mention about the one cornerstone called stress. I think the patients at us must find some time whether to discuss, are we managing the stress, are we evaluating our stress so that the diabetes is better controlled.
Actually, you have mentioned about obesity, that vicious cycle. Excellent. So I will say that diabetes is uncontrolled obesity also.
Excellent.
So first thing, when there is a visceral fat, that will hamper the function of pancreas.
Very true.
So we have to check and balance our fat in our body. So that check and balance should be done with we will end up there, proper diet, proper sleep, proper stress management.
So that is, I think, Dr. Raj, if you are summarizing these points, just randomly we talked about lifestyle, where we are talking about physical activity, we are talking about diet, we were talking about sleep, we were talking about stress management. Now, all this is also the contributing factor of obesity. So now this is a point that is now most looked upon by the world, not just on diabetes, but on obesity as well. Now, we know that diabetes is directly related to obesity, but that is a point I wanted to ask you. So how far are you looking into obesity management, Dr. George? Because we need to have a small discussion on the drugs also. So how do you look upon obesity?
Yeah, so when we come to obesity management, what I would like to highlight is the concept called as the metabolic syndrome.
Very
So that's as obesity with diabetes, it's a vicious circling itself.
excellent.
So that in that regard, we have what is known as a waist-hip ratio, both in males and females. This is one of the determinants.
Saying we will I'm happy that Dr. George did not mention anymore. So base
Waist-hip ratio.
excellent. Yes.
So the interesting thing in this regard is when you consider males and females, it's interesting to note that diabetes has a faster onset in males. Why is it due to? Because they have a more truncal fat. The truncal fat is more in this, but of course after menopause, it actually equalizes, or it might be more in the case of females. And then also in females after menopause, we see that the end organ damage is more. So all these are centered around obesity. So it has got a very important part to play in today's world.